Global change and epidemiological approaches. One source. The provided text, primarily excerpts from Ecosystem and Public Health, and its Chapter 1 and 2, introduces interdisciplinary approaches for researching global ecosystem change and its effects on public health. It outlines epidemiological study designs like cross-sectional, case control, and cohort studies as crucial tools for this research. The sources also discuss various factors influencing global change, including natural and anthropogenic dynamics, and emphasize the importance of geographic and other data sources in understanding these complex relationships. Furthermore, the text presents examples of health issues at different scales, illustrating the application of these research methods to real-world scenarios like air pollution and infectious diseases. Ultimately, it aims to equip readers with the knowledge to investigate the intricate links between environmental alterations and human well-being.
Lessons learned from the document. Based on the sources, several lessons can be learned regarding the study of ecosystem and public health. Interdisciplinary research is crucial for understanding the complex links between global ecosystem change and public health. Part 1 of the material emphasizes developing approaches for interdisciplinary research that considers natural and anthropogenic dynamics and their impact on health. Understanding these connections requires drawing on multiple disciplines. Epidemiological study designs are fundamental for establishing links between exposure and health outcomes. The text introduces various epidemiological study designs, including ecological, cross-sectional, case control, and cohort studies, highlighting their application in understanding health risks related to environmental change. A systematic approach is needed to gather and analyze information on global change issues. The complexity and interconnectedness of global change issues necessitate structured methods for finding, documenting, and using relevant information. The text mentions the importance of understanding the interaction of natural and anthropogenic dynamics. Research in this area often involves working with large and complex datasets and requires careful consideration of data quality and potential biases. The discussion addresses the use of geographic information, including data from Earth-observing satellites. It also highlights potential sources of error in epidemiological studies, such as random error, systematic error, including measurement bias and selection bias, and confounding. Understanding the scale of environmental health hazards is important for designing appropriate studies. Health hazards can manifest at individual, household, community, regional, and global scales, each requiring different approaches to investigation. The study of infectious and chronic diseases in the context of environmental change presents unique challenges. The complexity of interactions between environmental factors, hosts, and agents needs careful consideration. For chronic diseases, long time frames and diverse contributing factors add to the complexity. Examples of specific health issues illustrate the interplay between environment and public health. Filariasis in Egypt. Studies on filariasis demonstrate how environmental factors like water management and agricultural practices can influence disease prevalence and distribution. Trachoma in Tanzania. Research on trachoma highlights the role of household conditions and hygiene practices in the transmission of infectious diseases. Air pollution in China. Investigations into air pollution in China reveal its association with respiratory illness and lung cancer, emphasizing the impact of industrial and domestic activities on air quality and health. Radiation-induced illness from the Chernobyl accident. The Chernobyl example underscores the long-term health consequences of environmental disasters and the need for cohort studies to assess these effects. Mortality in refugees from Iraq and Rwanda. Studies on refugee populations illustrate the severe health risks associated with displacement, including malnutrition and infectious diseases, and the challenges in obtaining accurate mortality data in emergency situations. Rodents and hantavirus pulmonary syndrome in the United States. Research on HPS demonstrates how ecological changes affecting rodent populations can lead to increased human exposure and disease risk. Sun exposure and skin cancer in Australia. Studies in Australia highlight the link between high levels of UVB radiation and increased risk of skin cancer. Polychlorinated biphenyls and low birth weight in Sweden. Research on PCBs shows how environmental contaminants can impact reproductive health and infant development. Schistosomiasis and bladder cancer in Egypt. Studies in Egypt reveal the association between schistosomiasis and an increased risk of bladder cancer, influenced by water contact and hygiene. Vitamin C deficiency and scurvy in refugees from Ethiopia. Investigations among Ethiopian refugees demonstrate the impact of inadequate nutrition on health in displaced populations. Fish consumption and mercury in Canada. Research in Canada highlights the potential for environmental contamination of food sources and the associated health risks, such as increased mercury levels in fish and their consumption. Water contact and parasitic disease in Chad. Studies in Chad show the relationship between water sources sanitation and the prevalence of parasitic diseases. Traditional risk assessment is being expanded to include ecological, social, and economic factors. This broader perspective is essential for developing effective public health and environmental protection policies. The World Wide Web serves as a valuable resource for information and data relevant to global ecosystem change and public health research. These lessons emphasize the interconnectedness of environmental and human health, the importance of rigorous scientific methods for investigation, and the need for interdisciplinary collaboration to address the complex challenges at this interface.
What should be considered when designing an epidemiological study? When designing an epidemiological study, several crucial factors should be taken into account to ensure the study is effective and yields meaningful results. The sources highlight the following considerations. Clearly defining the research question. The study should aim to answer specific questions regarding changes in the distribution of health-related states or events in defined populations and the determinants of these changes. This can be framed using the what, who, when, where, why questions of epidemiology. Specifically, you need to consider what are the changes in health-related states or events, disease, injury, disability, or death being studied? Who? What is the population affected by these changes, defined by characteristics such as age, gender, residence, occupation, and location? When? What is the timing of the changes being investigated, including past observations and potential future projections? Where? What are the geographic locations relevant to the health issue, ranging from local to global scales? Why? What are the determinants of the changes, including biological, genetic, environmental, social, and economic factors, as well as potential infectious agents? Selecting an appropriate study design. The choice of study design depends on the research question and available resources. The sources introduce several epidemiological study designs. Ecological studies. These compare disease frequencies between different groups or populations. Cross-sectional studies. These examine the prevalence of a disease and related factors in a defined population at a specific point in time. They are useful for describing the health status of a population and exploring associations, but may have limitations in establishing causality due to the temporal ambiguity between exposure and outcome. Examples include studies on vitamin C deficiency in refugees, fish consumption and mercury levels, and water usage and trachoma in Brazil. Case control studies. These compare individuals with the disease cases to individuals without the disease controls to look for differences in past exposures or risk factors. They are particularly useful for studying rare diseases. Examples include studies on rodents and hantavirus pulmonary syndrome and polychlorinated biphenyls and low birth weight. Matching cases and controls on certain characteristics is important to avoid confounding. Cohort studies. These follow a group of individuals, the cohort, over time to assess the incidence of disease in relation to prior exposures. They can establish temporal relationships between exposure and outcome. Examples include the study of radiation-induced illness after the Chernobyl accident. Cohort studies can be prospective or retrospective. Addressing potential sources of error. Careful consideration must be given to potential errors that can affect the validity of the study results. These include random error. This is due to chance and can be reduced by increasing the sample size. Systematic error. Bias. This results from flaws in the study design or execution and can lead to inaccurate estimates of association. Types of systematic error include black small square, measurement bias, Information bias. This occurs when measurements or classifications of exposure or outcome are inaccurate. For instance, recall bias can affect the accuracy of exposure information in case control studies. Black small square. Selection bias. This occurs when the selection of study participants differs systematically between groups, leading to a non-representative sample. For example, differential loss to follow-up in a cohort study can introduce selection bias. Confounding. This occurs when a third factor is associated with both the exposure and the outcome, potentially distorting the observed association. Strategies to control for confounding include matching in case control studies and statistical adjustment in the analysis. Defining and measuring exposures and outcomes. Clear and precise definitions of the exposures and outcomes of interest are essential for accurate data collection and analysis. The methods used to measure these variables should be reliable and valid. Determining the study population and sample size. The study population needs to be clearly defined, and the sample size should be adequate to provide sufficient statistical power to detect a meaningful association if one exists. Considering the scale of the health hazard. Health hazards can operate at different scales: individual, household, community, regional, global, and the study design should be appropriate for the scale of investigation. Utilizing available information and data sources. Researchers should leverage existing data sources, including geographic information from Earth-observing satellites, health records, and surveillance systems, where appropriate. The quality and completeness of these data sources need to be evaluated. Addressing ethical considerations. Although not explicitly detailed in these excerpts, ethical principles related to participant consent, data privacy, and the responsible conduct of research are fundamental in epidemiological studies. Planning for data analysis. The statistical methods to be used for analyzing the data should be considered during the design phase to ensure that the collected data will be appropriate for addressing the research questions. The examples provided in the sources, such as the studies on filariasis in Egypt, trachoma in Tanzania, air pollution in China, and hantavirus pulmonary syndrome in the United States, illustrate how different study designs are applied to investigate specific environmental and public health issues, and they implicitly highlight the importance of considering these design elements.
You're joining us for a deep dive into a really crucial topic today. We're exploring how the health of our planet's ecosystems and, well, our own public health are so tightly linked. We've got a fascinating collection of information that you shared with us, covering everything from the sort of big picture ecology stuff down to the really detailed world of epidemiology and even, how societies fit into it all.
Yeah, it's a broad scope.
It really is. It's a big picture. But piecing these connections together feels absolutely essential now, doesn't it?
Yeah.
Especially with how fast the world's changing.
Absolutely. And the material you've gathered gives us a fantastic jumping off point. It looks at how we even how we learn about these massive global shifts, the different ways we study these relationships, the different lenses, you could say, and then some very specific examples of how environmental changes directly hit our well-being.
So the mission is to really dig into the core ideas here and figure out why they matter so much.
That's the plan, to understand the significance.
Okay, let's dive in then. Starting with this overarching idea of global change. Your sources really hit home just how complex and interconnected everything is.
Right.
It's not just one single issue acting alone, is it?
Not at all. Not in the slightest. Information on global change, it truly crosses, all sorts of disciplines, and it spans the entire globe.
Right.
What's really interesting, I think, is how electronic communication, the internet, has fundamentally changed how we grasp these interconnected problems. But at its heart, the real driver is this interplay between natural forces, the stuff that's always shaped the planet, and the growing impact of human activity, what scientists call anthropogenic dynamics.
Anthropogenic dynamics. So human-caused changes interacting with natural cycles.
Exactly. Think of it like a hurricane naturally reshapes a coastline, right? That's natural. But then the anthropogenic dynamic is us building cities right on that coast, making them vulnerable. That's a change driven by our choices interacting with the natural event.
Gotcha. So it's this constant back and forth between nature and what we do that's really defining things now. One of your sources had that figure 1.1, which laid it out really well.
Oh, yeah, that's a helpful visual.
It showed things like declining resources, population growth, farming, industry, all these pieces influencing each other and affecting basics like our air, water, land, energy.
Precisely. You can see right there in the figure how, say, changes in air and climate ripple outwards. They affect water resources, land use, even energy needs. It's a proper web. And, you know, the internet gives us amazing tools to research these links. It's also a real challenge, isn't it? Sifting through all that information to find what's actually solid and relevant.
Definitely. Information overload is real. Okay, so the materials also zoned in on 4 essential natural resources: air and climate, water, land, and energy. Things we often just assume will be there, but they're constantly changing, and our actions have a huge impact. Let's start with air and climate. It's not just about climate change in the big general sense, is it? There's more to it.
No, that's right. Climate change is obviously a huge piece, but there's also stuff like stratospheric ozone depletion, remember the ozone hole, letting more UV radiation through. And then there's transboundary air pollution, smog drifting across borders. All these atmospheric changes have direct knock-on effects for the whole planet and, crucially, for our health.
And water. I mean, fundamental for survival. The sources mentioned issues with both how much is available and its quality, and how the whole water cycle is linked to climate. So it's more than just, is the tap running?
Oh, absolutely. Contaminated water is, it's a massive pathway for diseases. Think cholera, typhoid.
Right.
And when climate change shifts rainfall patterns or causes more extreme floods or droughts, that can completely alter where and when these waterborne diseases pop up. It's a very direct environmental health link.
Okay. Then there's land use.
Yeah.
Things like deforestation, desertification. These sound like purely environmental problems, but they have huge human consequences, don't they? Like affecting our food supply or even biodiversity, the variety of life.
Absolutely. How we manage land directly impacts our ability to feed ourselves, for one. And maintaining stable natural systems relies on that land use being sustainable. Losing biodiversity, too, can have unexpected consequences, potentially making ecosystems less resilient and maybe even increasing our vulnerability to certain diseases.
And the last one, energy. The sources talk about the sun, obviously, and then carbon-based fuels. We hear debates about energy constantly, but it's worth remembering our choices there have these really significant global ripple effects.
Indeed. Our reliance on burning carbon fuels, while it's powered so much development, has major environmental consequences, especially for the climate. Shifting towards cleaner, more sustainable energy is, well, it's a critical part of tackling this whole interconnected web of challenges.
And we can't really discuss global change without talking about population growth. I mean, more people generally means more strain on resources and the environment. The sources also mentioned urbanization and migration patterns. It's not just the sheer number of people, but where and how they live, right?
That's a really critical point. Urbanization, people moving to cities, it has pros and cons. Cities can be efficient in some ways, yes, but they also concentrate environmental health risks. Think air pollution hotspots, water contamination issues, waste disposal challenges. And migration, which is often pushed by environmental pressures or lack of resources, that creates its own public health challenges, both in the areas people leave behind and the new places they settle.
And finally, the sources touched on economic development and industrialization, obviously brought huge benefits, but there's also a caution about the potential downsides. Resource consumption, sustainability, it sounds like a balancing act.
It absolutely is. Economic progress and industrialization have lifted millions out of poverty, no question. But we have to consider them alongside environmental sustainability. High consumption, unsustainable practices, they just worsen the global environmental problems, which in turn circle back to harm public health.
So it's all incredibly interlinked. Which brings us to the next big chunk of your source material. How do we actually study these complex connections? And that's where epidemiology comes in.
Exactly. Epidemiology, it's often called the basic science of public health.
Right.
It's all about figuring out the distribution, who, where, when, and the determinants, the why of health issues in populations. And the sources make it clear that studying something as massive as global change and its health impacts requires a whole toolkit of different epidemiological methods.
Okay, so what are some of those key methods? The sources start with descriptive measures.
Right, so the basics. Things like incidence rates. That's the number of new cases of a disease appearing in a population over a specific time.
Okay, new cases.
And prevalence rates, that's the total number of cases, new and old, existing in the population at a particular point in time.
Got it. Total cases.
These give us that fundamental picture of disease patterns. We also look at things like mortality rates, obviously, and infant mortality rates. Those are really key overall health indicators for a population.
But the sources also included a warning, didn't they? About just comparing raw numbers between places. That box 2.6 comparing the U.S. and Egypt.
Ah, yes, that's a crucial point. You can't just compare the crude death rate in, say, a country with lots of older people to one with a very young population and draw simple conclusions.
Because older people are naturally more likely to die.
Exactly. The age structures are different. That's why epidemiologists often use age-adjusted rates. Like in Table 2.1 they showed. It basically creates a statistical way to compare populations as if they had the same age distribution. Makes it a fairer comparison.
Okay, that makes sense. Then we move into specific study types. The first one mentioned was ecological studies. What are those about?
Ecological studies look for associations between, say, an environmental factor and a health outcome across entire populations or groups rather than individuals.
Ah, so group-level data.
Right. The example of linking general air pollution levels in Chinese cities to overall respiratory illness rates in those cities, that's an ecological study. Or looking at heat wave frequency in different regions and overall mortality rates in those regions.
So they can flag potential issues on a large scale.
They can, yes. They can generate hypotheses. But, and this is a big but, you have to be really careful about the ecological fallacy.
Okay, what's up?
It's the trap of assuming that an association you see at the group level holds true for every individual within that group. Just because cities with higher air pollution have higher lung cancer rates doesn't automatically mean your lung cancer was caused by that air pollution. There could be other factors at play for individuals.
Right. Correlation at the group level doesn't equal causation at the individual level.
Precisely. That's a key limitation to keep in mind.
Okay. Next up were cross-sectional studies. These sounded like taking a snapshot in time.
That's a great way to put it. You assess both the exposure and the disease status of individuals at the same single point in time, like going into a refugee camp and checking vitamin C levels and signs of deficiency right now.
Or that figure 2.2 example, looking at water use habits and trachoma infection in people in Brazil at one specific time.
Exactly. They're really useful for measuring prevalence, how common something is right now. And they're often quicker and cheaper than other study types.
But the downside?
The main challenge is figuring out what came first, the chicken or the egg. Since you're measuring exposure and disease simultaneously, it's often hard to know if the exposure led to the disease or if maybe having the disease changed someone's exposure. It's tough to establish causality.
Okay. Then we have case control studies. How do these work?
With case control studies, you start with the outcome. You identify a group of people who have the disease or condition in the cases.
Right.
And you compare them to a similar group of people who don't have the disease, the controls. Then you look backwards in time, often through interviews or records, to see if the cases were more likely to have been exposed to a particular risk factor than the controls.
Ah, so looking back for past exposures. The sources mentioned studying people with hantavirus pulmonary syndrome and looking back at their contact with rodents.
Yep, that's a classic example. Or the Australian study comparing people with skin cancer to controls without it and asking about their lifetime sun exposure.
What are these good for?
They're particularly good for studying rare diseases because you start by finding the people who already have it. They're also efficient for diseases that take a long time to develop.
Annie Kitches.
One potential issue is recall bias. People who are sick might remember their past exposures differently, maybe more thoroughly, or maybe they're searching for a cause compared to healthy controls. Getting the control group properly matched is also really important.
Makes sense. And that leads us to cohort studies. These sound more like following people forward in time.
Exactly. In a cohort study, you start with a group of people, the cohort, who are initially free of the disease you're studying. You assess their exposure status, who's exposed to the factor of interest, who isn't.
Okay.
And then you follow everyone in the cohort over time to see who develops the disease. You compare the rate of disease development in the exposed group to the rate in the unexposed group.
Like the Chernobyl example.
Mm-hmm.
Following people exposed to radiation versus those less exposed, and seeing who developed thyroid cancer, like in Table 2.4.
Precisely. Or that Swedish study mentioned, following women exposed to PCBs during pregnancy and seeing if their babies had lower birth weights compared to unexposed women's babies.
These sound quite powerful for establishing cause and effect.
They are generally considered stronger for inferring causality because you can establish that the exposure came before the disease developed. You can also study multiple outcomes from a single exposure.
But I imagine they take a while.
They certainly can, especially for diseases with long latency periods. And they can be very expensive and complex to run, keeping track of large groups of people for years or even decades. Loss to follow up people dropping out of the study can also be a problem.
Okay, so different tools for different jobs. The sources also briefly mention specific issues in studying infectious diseases, the whole agent-host-environment triangle. That seems like its own special area.
It is. With infectious diseases, you're dealing with a transmissible agent, so you need to understand the germ itself, the susceptibility of the person, the host, and the environmental conditions that help or hinder transmission. It adds another layer of complexity compared to many chronic diseases.
Right. And throughout all this, the concepts of risk and rates kept popping up. Incidence rate, prevalence rate, you mentioned those, and the term hazard. It's all about quantifying the likelihood of health outcomes.
Exactly. Epidemiology is fundamentally quantitative. We need ways to measure how often diseases occur, rates, and the probability or potential for harm associated with certain exposures. Risk, hazard. These numbers help us compare risks between groups, identify high-risk populations, and track trends over time. An increased incidence rate, for example, clearly signals that the immediate risk, the hazard, of getting that disease is rising in that population.
Of course, no study is perfect. The sources also covered potential errors. There's random error, just chance variation.
The luck of the draw, always a factor, especially in smaller studies.
But then there's systematic error, or bias.
Yes.
It's like measurement bias, how you select people, and that ecological fallacy again.
Right. Systematic errors are flaws in the study design or conduct that lead to results that are consistently skewed away from the true value. Measurement bias means you're measuring exposure or outcome incorrectly. Selection bias means the groups you're comparing aren't truly comparable to begin with. And the ecological fallacy, as we said, is applying group findings inappropriately to individuals.
And the third type was confounding. You mentioned this earlier, where something else is mixed up with the exposure and the outcome.
Yes, confounding is a really important one. It happens when another factor, a confounder, is associated with both the exposure you're studying and the health outcome, but it's not part of the causal pathway you're interested in.
Like the ice cream and sunburn example, hot weather is the confounder.
Exactly. Hot weather leads to more ice cream sales and more sunburns. If you didn't account for the weather, you might wrongly conclude ice cream causes sunburn. Good epidemiologists spend a lot of time thinking about potential confounders and trying to control for them in their study design and analysis.
So researchers really need to be aware of all these potential pitfalls.
Absolutely. Rigorous study design and careful analysis are crucial to minimize these errors and biases so we can have more confidence in the findings.
What I found really neat was the idea of using these different methods sequentially, not just picking one, but using them together. The example of lymphatic filariasis in Egypt really highlighted this. It wasn't just one study, was it?
No, that's a fantastic example of how the different approaches build on each other. You might start with descriptive studies or cross-sectional surveys, like in Figure 2.5, to just map out where the disease is most prevalent and get a basic understanding.
Okay, get the lay of the land.
Right. Then maybe you do a case control study, like some findings shown in Table 2.5, to quickly identify potential risk factors like, are people with the disease more likely to live near certain water sources?
Generating hypotheses.
Exactly. And then, if possible, you might follow up with a cohort study to get stronger evidence on those risk factors and really nail down the timing and the magnitude of the risk. It's like assembling a puzzle piece by piece using the strengths of each study design.
So it becomes a much more robust investigation overall.
Definitely. It's often that combination of evidence from different types of studies, all pointing in a similar direction, that gives us the strongest confidence in understanding a complex health problem and how to tackle it.
So wrapping this all up, it seems incredibly clear from the sources just how deeply our global environment and our health are intertwined. You really can't separate them.
No, you can't. They're fundamentally linked.
And epidemiology, despite all the challenges and potential errors we need to watch for, gives us this really powerful set of scientific tools to actually investigate and understand those complex links.
That's right. Understanding these intricate relationships and using these epidemiological methods rigorously is absolutely fundamental if we want to make informed decisions and create effective public health actions, especially in the face of ongoing global environmental change.
Well, this has been a fascinating deep dive into the connections between ecosystems and public health and the methods we use to study them. It leaves us with a final thought for you, our listener. Given this incredibly complex web of environmental factors, health outcomes, and societal influences, what do you see as the most critical priorities for research and action in the next few years? Where should interdisciplinary efforts focus to ensure we have both a healthy planet and healthy populations? Something to think about, including the very real ethical and practical challenges involved. Thanks for joining us on this deep dive.